I'm Alex. Mark to have you here. Your health comes first. If you've got any questions, just drop them. Let's begin this.
As you know, heart failure means the heart is weakening and pumping less blood, not stopping entirely. This chronic condition affects over 6 million Americans, often going undetected until severe. This condition doesn't signify the heart stopping but reflects a progressive weakening where it struggles to pump blood effectively. In this video, we'll explore 13 early warning signs and symptoms of heart failure, explained with mechanisms, real-life examples, and supportive research. Let's find out the early warning signs and symptoms of heart failure to discuss one by one. 1. Shortness of breath during activity, exertional dyspnea. Sudden breathlessness even after light activities like climbing stairs may indicate heart failure. Mechanism: weak heart pumps less oxygen-rich blood, causing lungs to overcompensate. Real-life example: struggling to climb stairs or walk short distances without pausing. Research evidence, highlighted as the most common early symptom by the American Heart Association. 2. Breathing difficulty when lying down, orthopnea. Needing multiple pillows or sleeping upright for comfort may signal heart issues. Mechanism: lying down causes gravity to redistribute blood, overwhelming a weak heart. Real-life example: progressing from one pillow to sleeping in a chair to breathe easier. Research evidence, typically occurs 2 to 4 hours after falling asleep. 3. Sudden nocturnal breathlessness, paroxysmal nocturnal dyspnea. Mechanism: nighttime fluid redistribution floods the lungs due to the failing heart. Real-life example: rushing to open windows to breathe at night. Research evidence, typically occurs 2 to 4 hours after falling asleep. 4. Unrelenting fatigue. Exhaustion that isn't relieved by rest can be an early indication. Mechanism: blood flow is prioritized to vital organs, leaving muscles deprived. Real-life example: routine tasks like grocery shopping or showering feel draining. Research evidence often precedes a formal diagnosis of heart failure. 5. Swollen ankles, feet, or legs, peripheral edema. Visible swelling in the lower extremities often points to poor circulation. Mechanism: fluid retention triggered by weak circulation causes swelling. Real-life example: socks leaving deep grooves or tight shoes by the evening. Research evidence, present in about 70% of diagnosed cases. 6. Rapid weight gain from fluid retention. Unexplained weight increase over a few days suggests worsening heart failure. Mechanism: heart failure triggers excess salt and water retention. Real-life example: gaining 2 to 4 pounds overnight or over a week. Research evidence, the American Heart Association flags this as an urgent sign. 7. Frequent nighttime urination, nocturia. Waking up multiple times to urinate at night could indicate fluid balance issues. Mechanism: lying flat redistributes daytime fluid accumulation to the kidneys. Real-life example: emptying large amounts of urine at night compared to daytime. Research evidence, a common precursor to more apparent symptoms. 8. Nighttime cough or wheezing. Persistent coughing when lying down could signify fluid buildup in the lungs. Mechanism: lying down shifts fluid toward the lungs, irritating airways. Real-life example: worsening cough relieved by propping up with pillows. Research evidence, often mistaken for allergies or reflux, but common in heart conditions. 9. Heart palpitations. Irregular heartbeats or fluttering sensations can indicate heart strain. Mechanism: a weakened heart struggles with efficient blood flow, causing arrhythmias. Real-life example: feeling the heart skip or race even while at rest. Research evidence, frequently associated with atrial fibrillation linked to heart failure. 10. Dizziness or lightheadedness. Recurrent dizziness after standing or exertion may reflect inadequate blood flow. Mechanism: weak heart struggles to maintain consistent blood supply to the brain. Real-life example: needing to grab support when standing due to faintness. Research evidence, common among 20% of identified heart failure cases. 11. Abdominal bloating and poor appetite. Digestive symptoms like feeling full quickly could be heart-related. Mechanism: backed up blood affects the digestive tract and liver, causing bloating. Real-life example: eating just a few bites but feeling overly full or heavy. Research evidence: frequently overlooked but common in early stages. 12. Breathlessness when bending, bendopnea. This specific symptom signals advanced heart stress. Mechanism: forward bending increases chest and abdominal pressure on a weakened heart. Real-life example: pausing mid-task to catch your breath when bending over. Research evidence: found in 30% of advanced cases and linked to higher mortality. 13. Cold or bluish hands and feet. Circulatory changes like cold extremities and bluish nails indicate reduced blood flow. Mechanism: heart prioritizes vital organs, depriving the extremities. Real-life example: icy hands even in warm conditions, along with bluish nails. Research evidence reflects reduced cardiac output and heightened risk. Importance of early recognition. If you recognize any of these 13 early warning signs, don't ignore them. Heart failure symptoms often appear subtly but collectively signal an underlying problem. The good news is early detection allows for effective intervention through medications, lifestyle changes, and medical care. Be proactive. Consult a medical professional if you notice multiple symptoms. Early action can strengthen your heart and enhance your quality of life. Stay vigilant and prioritize your health. Thanks for watching, and subscribe now and take control of your well-being the smarter way.